Hello, everyone, and thank you all for joining us during the Lytham Partners Spring 2024 Investor Conference. My name is Ben Shamsian, Vice President of Lytham Partners. During the presentation on Fireside Webcast today, I'm excited to welcome Syra Health, ticker symbol SYRA on the NASDAQ. Joining us today from the company is Dr. Deepika Vupalanchi, Chief Executive Officer. Before we begin, I want to remind everyone that management is available for one-on-one meetings throughout the conference. If you've not already signed up and would like to schedule a one-on-one, please send me an email at shamsian@lythampartners.com. That's SHAMSIAN@lythampartners.com, or visit lythampartners.com/spring 2024. With that said, Dr. Vupalanchi, I know you have a few slides you wanted to run through, but before we get into questions, so the floor is yours. Thanks.
Thank you, Ben, and thank you, Lytham Partners, for having me. This is a great platform, and this is the second time we are here presenting. So thanks again. We have a great story to tell, and thanks all of you for tuning in to listening to our story. Definitely have a few slides. We'll give you an overview of our company, our business units, our growth path, and our strategy. This is our forward-looking statements and our story, right? So we are a growing healthcare technology company, and we provide innovative services and solutions. We have 5 major business units, and I'll go through all of these units and give you a clear understanding of what we do. But at the essence, at the core of all of our services, we have the theme of prevention. How do we prevent diseases from progressing? How can we improve accessibility and affordability? So our 5 business units are right on the right side of the slide. We have divided them into high profit margin units and those which are more on the sustainable revenue bringing units. So our first unit is behavior and mental health. We have a proprietary mental health platform, Serenity, which is a comprehensive mental health solution, and this is catered to all users, youth and adults, and across all key stakeholders in the healthcare. We work for providers, payers, academia, large employers who will see benefits utilizing our app. We have population health and digital health. On the sustainable revenue side, we have healthcare workforce. This is our clinical workforce staffing solution, and it's been our legacy service line, and we continue to do business in this area. We have health education as well. And, we provide turnkey digital health solutions that help improve engagement, education, and also improve operational efficiencies for different hospitals, clinics, and other organizations. A large volume of our revenue comes from state government contracts. So you can see how we have a recurring revenue line. We have, again, revenue streams coming through our digital product subscriptions and a lot of organic growth. Our profit margins have been increasing, and as we have more customers in our high profit margin business units. We have achieved 47% increase in our first quarter 2024 compared to the Q1 2023. And I'll walk you through our financial guidance for 2024, and we are estimating record revenues and beyond. With that note, I will start moving into each of our business units and give you a flavor of what we do and who we serve. So who do we serve, right? We empower key partners across the healthcare ecosystem. We work with providers, government, academic institutions, life science organizations, and payers. So behavior and mental health, as you might know, how the country is facing a major crisis as it relates to mental illness. There's a lot of statistics out provided by NAMI and CDC, a lot of numbers, but then eventually all of these turn to millions of people who are with us. It could be our family, friends, colleagues, somebody in a line in a Starbucks, right? So this is everywhere. And the need is there. There's a lot of attention from federal and state organization and private entities as well. So with that unmet need, the market size is also huge. It's 132.4 billion market size expected by 2027. And we are fortunate to be able to provide solutions in this space. We have developed an in-house proprietary product. It's called Serenity. It is a mental health app. And as you can see, it has two areas, prevention and intervention. So there are multiple mental health products out in the market. You might be thinking, what is new or what is different, right? Most of the solutions are focused on providing behavior health licensed therapist by telehealth, which is just one piece of what we offer. We offer much, much beyond. We are focusing on assessments. How do we understand where a person's mental health journey is, or how do they stand today, and then provide tools for monitoring. And then there's the whole stratification, where what are those conditions that a person is more prone to based on the assessments they have done. And of course, this is backed by the latest technology, cutting edge technology with AI tools, which only help to enhance the engagement and also learn more about the users so that the interventions that are being provided, the education that is being provided is more targeted. There's a really innovative feature, what we call AI therapist. It's almost like having a therapist in your pocket. So this therapist talks and engages with the user throughout the day, understanding the moods, and also engaging and providing certain interventions that are, again, preference that it has learned about the user. So Serenity has a lot to offer on the prevention side. And for those who need that extra help with speaking to a licensed behavior therapists, we do have telehealth, we have crisis support features, and also care coordination. And how does this look in the revenue streams? Like we have customers, private sector customers right now who use like the monthly and the annual subscriptions. So that's one line of revenue stream. We also offer tiered subscription plans, in-app purchases, and also employer programs. And we are looking at great partnerships with the payers, health insurance, so that the members of their plans can utilize this feature for improving their mental health, and of course through telehealth. So a variety of ways revenue comes through this application. Moving on to the next section is digital health. And of course, we have innovative products here. Again, I'll focus on two areas, but generally the unmet need here is that there are a lot of digital health products which are associated with high cost, mostly non-customizable. And the market size is again huge. And we are offering two unique solutions. The first one is Syra Bot, which is a conversational AI-powered chatbot that helps to engage users in their health journey. It helps them connect, engage, learn, educate, and empower themselves. So this is a Syra Bot, again, developed with in-house. It's proprietary to Syra Health, and it is within the compliance and regulations of the healthcare world. We have implemented this for a major a payer in the state of Indiana, and it helps the plan members learn more about the health benefits, health plans, and also other educational health education materials that are previously approved by the payer organization and the state body. So it is not beyond the scope of the health regulation. So in a very powerful tool for the members to be engaged, improves satisfaction, improves access to care and information. And again, it is customizable to various member populations. It can speak in multiple languages. It has the ability to communicate in 200 plus languages. So again, it is a very robust, well-developed offering from Syra Health, and we hope to bring this to multiple payers and other state organizations as well. Care Plus is another digital product that we offer. It is the electronic medical record system, and it is more focused on the small to mid-size clinics and hospitals who cannot afford the big EMR systems that are out in the market. The more unique things that we offer is that it is a cloud-based platform, very new, very fresh, highly customizable, again, proprietary to Syra Health. So we have developers who can customize the clinical workforce to the needs of our customers. So again, bringing those differentiating factors, since it is a cloud-based, it is much more affordable than the other solutions that are out in the market. So our revenue streams come through, the typical product cycle or product revenue streams, implementation fees, subscriptions, customization, integration, training, and maintenance. So those are our digital health offerings. And as just a reminder, those digital health service line brings in those high margin profit just because of the nature of how digital products and tools work. A lot of R&D upfront, but later it translates into good margins. I'll move on to the next section, which is the population health. Again, consider this area as an area where we have data scientists, data analysts, health economists who look at huge health information, huge data coming from state organizations, public entities, and sometimes even private information, but de-identified. So we work with these data, look at disease trends, look at what are the upcoming trends that can be tracked at a population level. And we provide this risk stratifications, predictive analysis, and create meaningful reports that we then concise and provide in as an annual report or a quarterly report. And these information, these insights become the source of truth for government organizations to help shape the policies. So we first started in one state, in Indiana, and now our success has been able to replicate in multiple states. Our testimonials, our references speak them for themselves as we move from one state to another, from one department to the another, providing important solutions in the population health space. And we are also trying to make use of all the information that we have gathered. A lot of data we have accumulated through our projects, and how can we make this more relevant for other partners to utilize this data to understand more of those vulnerability index? How does the disease-centric models look like? And several other tools to the customers for risk prediction and further shaping their organization's strategy. And the revenue streams, these are again government contracts. And just to make a note on government contracts, for those who might know, the sales cycle is long, but also the term of these contracts is long. So usually they are between up to 4 years with additional years for contract amendments and extensions. And that's with the government side, but with the payers, we have contracts which are more on the value-based and managed care. We have healthcare provider partnerships. There's always consulting and training services because we have a really experienced team of subject matter experts and a plethora of other offerings that we bring. So that's our population health. And then moving on to the next business line, which is the healthcare workforce. As you know, there's a lot of data, information, news all the time that there is a shortage in clinical personnel, and this leads to a disruption to the care. And we are here to solve this problem. We are trying to alleviate the burden on the clinical staff by providing clinical personnel and ancillary clinical staff who can alleviate the burden on the current clinical staff, but also help in that continuum of care that is most required. So we provide staffing solutions for several state government organizations, local, county level, long-term and short-term government contracts. We have not even ventured into the private provider network, but that's something that we would look into in the future. But again, this has been our legacy service. We started with one contract in Indiana with the state psychiatric hospital, and that was for up to 22 million for a period of 6 years. That's just the beginning of our story, right? So that was state one. Today, we are proud to say that we are now active, we have active contracts in 20 plus states. So we are increasing our presence, our footprint across the country every day, every month, and bringing in more of those services and solutions that are meaningful and eventually helping in improving healthcare. I'll move on to the one of the last service line here on the health education. And this is just coming from my own background, having a PhD in molecular biology, worked as an academic scientist, then moved on to the private sector, worked with health education agencies and pharma companies. So it is a whole field of medical writers, technical writers who come together to create innovative educational content cater to different audience. It could be catered to patients, to physicians, or to payers. So we bring in this expertise and we provide two areas here, clinic healthcare training and patient education. A lot of our trainings, our current contracts are with state departments as well, where we train not only on the high science or disease-specific knowledge, but also other non-clinical subjects, but are very important for clinical care, such as, DEI or cultural competency, or how can we talk about trauma-informed care, social determinants of health, health equality, and all of those other areas that only enhance the care that can be provided to a patient, and how to individualize the care and also improve the patient satisfaction. So a lot of trainings that we are providing, and our revenue streams are again all the way from content development to conducting the trainings, providing consultations, and also providing asynchronous training mechanisms by the learning management systems, online trainings, webinars, and so on. I will now shift a focus little on to our government solutions. As I've mentioned through my presentation, that we work heavily with the state government organizations, and that's our story from the past 3 years from the inception of our company. But as we have gained so much success and so much learnings from our implementations and working with the state organizations, we now are entering, or we have entered into the federal government space, because we feel like we can replicate our success and bring our learnings to the federal opportunities as well. So with that, what is that we can derive working with federal government agencies, right? It only helps us bring in that large scale impact. Now we are doing state by state, but once it's a federal project, the impact is going to be big and bold, and that's what we are all driven to, improving healthcare. And this is a medium to do so. It helps us do diverse projects and of course increase our credibility and trust in the healthcare sector. And importantly, it's going to bring in a stable revenue stream to the company. With that note, we have working closely with some prime contractors on federal vehicles. We are a subcontractor with Caduceus Healthcare on a Health and Human Service Award or a vehicle. And the value of this vehicle has a ceiling at 75 billion. So there's a lot of work to be done, a lot of opportunities. We are waiting for the task orders, and once we succeed and win with those task orders, the amount of work is just going to be exponential, and hoping the revenues also match up to this exponential work that we are expecting. The most recent win is through working in partnership with Luke on the Defense Health Agency Award. Again, it has a ceiling of 43 billion. A lot of work coming our way, and we are excited to venture into the federal space and bringing in that value work that we have already presented and proven on the state government side. So, overall, our story is to grow grow strong by providing the most meaningful services and solutions in healthcare, but also deliver outstanding financial growth so that we can grow further as a company. And how are we doing this? So we are maximizing our strengths in our most profitable business units: behavior and mental health, population health, digital health. We are utilizing our core strengths to increase the total addressable market of a federal government business. We are improving our operational efficiencies through process optimization, automation, and technology adoption. We're also looking forward to collaborating, acquiring, or partnering with other health companies who have similar synergies and that align with our growth strategy. Always working towards enhancing our brand recognition, reputation, and trust. So quickly moving into some numbers, our revenue growth from first quarter of 2023 versus first quarter of 2024, we have seen 47% revenue increase. And also, if you're looking closely at the pie charts, what you can see is in last year, a lot of our revenue stream was coming from the healthcare workforce. And now there's a shift more into those profitable business units that I was mentioning. So we expect this trend to continue. And with this trend, we are hoping to see more of those profit margins increasing over a period of time. This is our annual revenue guidance. We are expecting a 64 to 100% growth in revenue, putting us at 9 to 11 million. And this is based on some of the contracts that we are currently in place. And this does not even include the opportunities that I discussed on the federal space. So we are very excited on how we are going to work in our upcoming quarters and all of the new projects that are going to be implemented and taking off. So with that note, Ben, I would like to open up for any questions that you may have or any of our audience may have.
All right. Well, thank you, Deepika, for that. We have some questions that I think are helpful to investors. First, how do you plan to grow and scale the business?
No, that's a great question. So as I mentioned, I'll just go back to the slide so it helps orient what I've just presented. So we are maximizing our strengths in the most profitable areas. We have a proprietary product, Serenity. It's launched. We have customers already on it, and we are trying to take this to more of those bigger organizations where the user base, the member base is large, and that is tremendously going to be helpful not in improving the behavior and mental health of the users, but also on the other side, it's going to have a lot of users on the app, a lot of revenue streams coming from the behavior and mental health. And on the population health and digital health, our customers pipeline is strong, it's growing, and we are excited for these implementations. And I think by focusing in the right space, right unmet need, and with the right team, we are able to increase our growth. And we're also looking at synergies with partnerships with other health organizations where we can go together to, collaborate and win bigger projects. So those are some of our strategies for growth.
Got it. Can you get a little bit more specific in terms of why you believe you're going to be successful in scaling the business? Talk about, a lot of it has to do with Serenity, Care Plus, Syra. Can you get a little bit more specific on those areas?
Yeah, definitely. Each offering that we present to our customers, again, the core is important. What are we trying to solve? Right? First of all, there's a lot of unmet need. And then we are also, the essence of all of our services are in prevention. Nobody else in the market talks about prevention. They're all focused on how do we treat a disease? What are the pharmaceutical interventions, or what are the tools that can help alleviate a condition, but where is the focus on prevention? So that sets us apart. And then affordability and improving access. again, our services are innovative, but also at the same time affordable. So that is again a differentiating factor for Syra Health. And these are the things that will help us penetrate the market more and more effectively and more meaningful for everybody, right? We want to make it affordable for our customers and to the end users. So that's where our goals are, and I think those are the things that just help give us the weapons to fight against the big players in healthcare.
Got it. Got it. Staying with Serenity and Care Plus and Cyberbot, what's the anticipated revenue there? I know you haven't provided specific guidance, but sort of help us understand how you're thinking about revenue there.
Yes, we have not provided guidance on specific business unit level. We have not gone to that detail, but overall, I can say that we have an amazing pipeline that we are very excited about, and it is all gonna shape, move that pie into lesser of the healthcare workforce and more of these business units that are on the profitable side.
Got it. Let's talk about the federal contracts. You've announced two of them. The numbers are very large. Can you talk about the sort of the anticipated revenue there, how you're thinking about revenue, how much of that is in your current guidance?
That's a great question. So in our current guidance, we have not included any expectations from the federal vehicle. So whatever we have is based on the other contracts, and these vehicles that we have won are very recent. So that means, it is hard to give a number, right? It could be 1 million to 100, right? So it is hard to say because it depends on the task orders that are going to be released by these agencies and how we work through implementing those task orders. But as we win, we will, as we solidify these task orders, we will do timely press releases that will give a more ballpark on the numbers than making a comment at this time.
Got it. Okay, thank you. Let's talk about your sort of the different business units. Are all of them generating revenue? And how can we sort of think about it from the various units?
Yes, we have positive revenues on all of our business units, and this has been since last year. So we are continuing to grow in each of the business units, and all of them are having organic growth and new wins. So it's all coming together to a big pool of company revenue. But to answer your question, yes, we have revenue streams coming from all of the business units that I mentioned.
All right. Well, thank you very much for your time today. Certainly found this very informative, and I believe our audience did as well. Before we wrap up, two quick reminders to anyone out there not already signed up for a one-on-one. Again, please send me an email at shamsian@lythampartners.com, shamsian@lythampartners.com, or again, visit lythampartners.com/spring 2024. And lastly, we have a number of additional webcast presentations coming up. Please visit the conference homepage for all the details. Deepika, once again, thank you for your time, and we hope you have a great rest of the conference.
Thank you, Ben. Thank you, Lytham Partners.